Hi, this is Dr. Paul Thomlinson from Compass Health Network, and I'm doing a continuing series applying evidence-based psychology to the issues and concerns of these times we're living in and living through. I hope what I have to say today will somehow contribute to our mission of inspiring hope and promoting wellness. This is a special two-part episode for May as Mental Health Awareness Month, and I'm talking about what we know about the mental health impact of the pandemic just over a year in. In part one, I went over myths about resilience and the impact of the COVID-19 pandemic. Here in part two, I want to go over the best evidence we have of the actual mental health impact of the pandemic, focusing on who might be most vulnerable and in need of support. And also, I want to offer an introduction to mental health first aid, which is powerful and an effective way to help people feel more equipped to recognize and help with mental health issues. So, on the subject of increased vulnerability to mental health problems, let me quickly summarize the best evidence we have on mental health status. Starting with an official statement from Captain Obvious, international studies show a significant increase in psychological distress worldwide. For example, between 2018 and April of 2020, last year when the pandemic was really gaining a foothold, the percentage of U.S. adults with depression jumped from 8.7% to 14.4%. That's from Daly et al. In the Journal of Affective Disorders. So another important study found that the average prevalence of psychological distress caused by the COVID-19 pandemic rose significantly from 24 to 66% of the population. These studies also show clearly that older people, that is, those over 75, exhibit less perceived stress, which is likely a consequence of the better emotional regulation that previous research has found to be present in older adults. Younger adults in the U.S. report significantly higher perceived stress levels, and this stress effect is even stronger among young females. Addressing matters near and dear to my heart, one study revealed that the depression increases, especially among young females in the U.S., is largely attributable to corresponding increases in loneliness. So a key takeaway from these studies, taken as a whole, is that we need to pay careful attention to the mental health status, specifically targeting young, female, and unemployed and lonely people. So if you have all four of those, that's really quite a risk factor profile. You may also be wondering about the relationship of the actual disease of COVID-19 and mental illness, and you would be right to ask, because new evidence shows that there is a two-way street running between these two. In patients with no previous psychiatric history, about 1 in 5 patients with COVID-19 developed a mental health condition within 14 to 90 days, with depression, anxiety, and PTSD being most common. And those with psychiatric diagnoses in the previous year were almost twice as likely to get a COVID-19 diagnosis. So, again, a two-way street between those two things. Those with serious mental illness are showing perhaps a surprising resilience in the face of the pandemic. In our focus groups with Compass clients, for example, the most frequent response when asked about the impact of COVID-19 on them was little or no effect on health and well-being. And that resilience hypothesis fits well with the findings from a new longitudinal study by Pinkham et al., which also found individuals with serious mental illness were not reporting worsening of symptoms or affective experiences, and instead appear to be fairly resilient in the face of the pandemic. Part of what I'm trying to do in these Mental Health Month episodes is to honor the incredible indwelling human capacity for resilience in the face of tremendous setbacks and gut-wrenching adversity at times. We can all do that more consciously and actively by developing an attitude of togetherness, or we-ness, as we say in group therapy sometimes, and translating that into direct behaviors that benefit others. And of course, this is particularly true of the most vulnerable in our communities. There's solid evidence that this has powerful effects on mental health resilience. And that's a great bridge for me to move to the final topic I want to talk about. A few years back, after over 20 years as a licensed psychologist, I spent nearly a week getting certified in what was then a pretty new program called Mental Health First Aid. I know that may seem strange, kind of like a cardiologist taking a CPR class or an ER doctor taking a basic first aid training, but I wanted to show my support for the concept and the movement. That is the idea that we should support people in learning how to better recognize when others are struggling with mental health problems. learning how to respond appropriately and helpfully, and helping people feel more comfortable in doing that. I bet many of you have had a CPR or first aid class. Now, some of you may have been able to use those skills you've learned there. But I can pretty much guarantee you that you're way more likely to encounter someone with a mental health problem or crisis in your daily life than you are to come upon someone in cardiac arrest. Thank goodness, probably. That's a statistical certainty, though, really. So what is it? Mental health first aid is an international movement that teaches participants about mental health and substance use issues. It gives you the skills you need to reach out and provide initial support to someone who may be developing a mental health or substance use challenge, and help them connect with the appropriate care. Missouri's Department of Mental Health has made significant investments in mental health first aid. The course is like a $170 value, but currently it's available free due to DMH support in Missouri in many places. So please check out the links provided in the podcast cover slide. It's where you can register for either a Compass first aid training or others available in Missouri. Now, we had to cancel most of our in-person trainings last year during the pandemic, but we're back with both virtual and in-person options starting up again. So what do you learn in mental health first aid? In addition to learning about signs and symptoms, prevalence of mental illness and substance use disorders, and so on, you get some very powerful experiential exercise to help better understand the lived experience of those with mental illness. Maybe most importantly, you learn how to feel more comfortable and confident in taking action, the so-called Mental Health First Aid Action Plan, which you can remember from the acronym ALGEE, A-L-G-E-E. You learn to assess for risk of suicide or harm. You learn to listen non-judgmentally, something that many of us think we're good at, but maybe are not as good as we think. We'll learn to give reassurance and information, encourage appropriate professional help, and encourage self-help and other support strategies. That's the ALGEE Action Plan. You spend a whole day learning how to do that. Now, I was trained as a scientist practitioner, as a psychologist, and so I'm always eyeing the research base for everything that I might recommend. And to that point, peer-reviewed studies show that individuals trained in mental health first aid show the following effects. They grow their knowledge of signs, symptoms, and risk factors of mental illness and addictions. Good thing. They can identify multiple types of professional and self-help resources for individuals with a mental illness or addiction. They increase their confidence in and likelihood of helping an individual in distress. And they show increased mental wellness themselves. Studies also show that taking mental health first aid training reduces the social distance created by negative attitudes and perceptions of individuals with mental illness. Now, doesn't it sound strange for me to report that as a positive thing in this current era that we're in? Reducing social distance, right? We're supposed to be all about social distancing, but this is a different concept. Social distancing has never been a good idea. Physical distancing in a pandemic rocks. That's a good thing. But social distancing is plainly and demonstrably not good for mental health. In this case, though, reducing social distance means people who take the course are more willing to be in closer physical proximity to people with mental illness. And by the way, that's one of the very few proven methods for reducing stigma, prejudice, and discrimination. Direct engagement and experience with people living with mental illness. It's the best way to see them for what they are, a fellow human being who's trying to live a life of meaning and purpose, just like most everyone else. And also doing it while experiencing the challenges and limitations that come with mental illness. That's the kind of resilience and recovery worth uniting around and celebrating. Finally, I want to let you know that I'm working on a new podcast episode just for you if you're among the many folks who are feeling stuck. Not really depressed, but not exactly flourishing. Not mentally ill, but not mentally well either. This is a state that has been named languishing. So come back soon for that one. I hope it will help you feel seen and heard, and inspired about moving beyond languishing.